How you doing? My name is Jay, and today we're going to talk about acute glomerulonephritis and your child. Presentation brought to you by Haley Toney, myself, Jay Gonzales, and Lauren Ross. Glomerulonephritis. What is it? Well, it's a form of kidney inflammation in which lesions are found in the glomeruli, causing the kidneys to work improperly. Now, usually this occurs after an infection of severe strep throat, usually found in school-aged children. If left untreated, then acute glomerulonephritis turns into chronic. The disease process. Well, the immune or antigen bacteria used to fight the infection become clogged in the nephrons, causing inflammation and scarring, which impairs the kidney's ability to filter blood and urine. This causes toxins and metabolic waste and excess fluids to then build up and cause symptoms you can see on the outside. Glomerulonephritis may be present 1 week to 10 days after strep throat or strep upper respiratory infection that was left untreated. Acute glomerulonephritis symptoms develop suddenly and resolve with treatment. Chronic glomerulonephritis happens when acute glomerulonephritis is left untreated and develops slowly and can cause irreversible failure of kidneys. So how is glomerulonephritis typically diagnosed, and what are some treatments commonly used? Well, some labs that are typically ran are consistent with a urinalysis. This test checks urine for red or white blood cells, infection, or too much protein. A blood test measures the level of waste products and finds out how well your kidneys are filtering. We can do a kidney ultrasound that shows the shape and size of the kidneys if they're abnormal, or kidney biopsy, which is tissue samples that are removed and checked under a microscope. Some of the treatments our patient might be prescribed blood pressure medications, corticosteroids, or diuretics, which is a water pill. Their diet habits might have to change. They may be placed on dialysis or even submitted for a kidney transplant. Some of the signs and symptoms would be consistent with dark brown, tea-colored urine, blood and protein in the urine, low daily urine output, joint pain, fatigue, high blood pressure, seizures, headaches, facial and peripheral edema, a sore throat, increased respiratory effort, and a rash on the lower body.
This is Haley Toney. For this slide, we're going to talk about some nutritional needs for your child. So to prevent further damage with the glomerulonephritis, school-aged children and young adults, also known as teens, might be recommended the following to promote healing. You're going to start with the diet restrictions to salt, protein, potassium, and phosphorus. You're going to eat a heart-healthy diet to keep cholesterol low to reduce the kidney's workload, such as a moderate intake of fruits and vegetables, eat whole grains such as oats, multigrain, and brown rice, unprocessed lean proteins or plant-based proteins. Use canola oil, olive oil, avocado oil when cooking instead of butter. You're going to take calcium and vitamin D supplements to help offset some of the medications your child may be on, like corticosteroids that help with inflammation. You're going to increase the omega-3 fatty acids in your child's diet to help decrease inflammation. Be active with your child, regular exercise, playing outside, taking part in sports activities daily. And then speak with the dietitian to help create a more specific diet plan to meet your child's needs. So these are some of the things that you may see your nurse doing to help your child. They're called interventions. So you may see them administer antibiotics to treat the strep infection. They will encourage your child to ambulate to decrease peripheral edema, provide quiet play, reading, TV, and games as symptoms subside. They will also provide you with information on a renal diet. They'll administer diuretics to help decrease fluid retention and hypertension. So that's just any excess fluid that your child is showing. It'll help get rid of that. They will assess your child's lung sounds and respirations, correct electrolyte imbalances with IV fluids, monitor patient vital signs every 4 hours. They'll monitor the hypertension and lab values, daily weights for the patient on the same scale at the same time daily. They will also administer phosphate binders to decrease levels in the blood, measure and record abdominal girth, maintain strict I&Os or fluid restrictions as ordered. I&Os is the intake and output of daily fluids for your child, and your child may be on a fluid restriction depending on how much edema they have. Dialysis may be used as a short-term management for waste products in the blood. And now we have our first NCLEX question. A 5-year-old male is admitted with acute glomerulonephritis. On assessment, you note mild edema, predominantly in the face, and tea-colored urine. The patient's blood pressure is 165/110 with a heart rate of 95, an O2 saturation of 98% on room air, and a temperature of 98.9 Fahrenheit. In your nursing care plan, what nursing interventions will you include in this patient's plan of care? Select all that apply. A, initiate and maintain a high sodium diet daily. B, monitor intake and output hourly. C, encourage the patient to ambulate every 2 hours while awake. D, assess color of urine after every void. E, weigh patient every day on a standing scale. F, encourage the patient to consume 4 liters of fluid per day. So the answer for question number 1 is going to be B, D, and E. Patients with acute glomerulonephritis experience proteinuria and hematuria. In addition, they may experience mild edema, mainly in the face and eyes, hypertension, and in severe cases, renal failure and oliguria. Therefore, it is very important for the nurse to monitor intake and output every hour, assess the color of the urine, and weigh the patient every day on a standing scale.
Hi, this is Lauren Ross, and I'm going to be starting you off with your second NCLEX question. While providing care to a pediatric patient with acute glomerulonephritis, you note that the urine output is 10 milliliters per hour. The patient weighs 30 pounds. As the nurse, you will want to limit what type of foods from the patient's diet. A, calcium-rich foods. B, potassium-rich foods. C, purine-rich foods. D, none of the above because the patient's urine output is normal based on the patient's weight. The answer to question 2 is B. The rationale for this is the patient is experiencing a low urinary output. The patient weighs 30 pounds, which is 13.6 kilograms. Remember, a normal urinary output for a pediatric patient should be 1 milliliter per kilogram per hour. Based on the patient's weight, their urinary output is 10 milliliters per hour. It should be 13.6 milliliters per hour. Therefore, the patient is at high risk for retaining potassium due to decreased renal function. The nurse should limit foods high in potassium. Question 3. Which of the following are not a sign or symptom of acute glomerulonephritis? A, hypotension. B, increased glomerular filtration rate. C, cola-colored urine. D, massive proteinuria. E, elevated BUN and creatinine. F, mild swelling in face and eyes. The answers to question 3 are A, B, and D. The rationale for this is the patient with AGN may experience hypertension, not hypotension, decreased glomerular filtration rate, not increased, mild, not massive, proteinuria. This concludes our presentation. Thank you.